This presentation details placement of landmarks on the base of the skull so that the landmarks can be used to quantify alignment and motion in the upper cervical spine. This is a view of the base of the skull. The skull base is clinically important when assessing alignment and motion in the upper cervical spine. Motion and alignment are partially controlled by the occipital condyles that articulate with the superior condyles of the first cervical vertebra. The skull base has lots of important anatomic landmarks, but this presentation focuses on only two landmarks in the mid-sagittal plane. The first is the basion that marks the anterior-most point of the foramen magnum. The second is the opisthion that marks the posterior-most point on the foramen magnum. The foramen magnum is the opening where the brainstem passes through the skull base to connect with the spinal cord. This is a panel of images created from a thin slice CT exam of the cervical spine. The basion is here shown on the axial plane, confirming that it is in the mid-sagittal plane. In the frontal plane, you can see it is at the inferior-most point on the skull base. In the mid-sagittal plane, which is one of the most important views, you see the basion marks a specific point on the anterior-most edge of the foramen magnum. Assessing the basion on a three-dimensional reconstruction of the anatomy helps to confirm the location of the basion. The basion is in the mid-sagittal plane and there is a lot of anatomy to the left and right of the basion. If we remove the right half of the anatomy, you can appreciate the position of the basion embedded within the surrounding anatomy. When a lateral X-ray is taken, the X-ray beam passes through all of the anatomy to the left and right of the basion, as well as the basion, and the challenge is to learn how to identify the basion and not any of the surrounding anatomy. This video shows an X-ray-like view of the basion and all of the surrounding anatomy. The basion is in the mid-sagittal plane and there is a lot of anatomy to the left and right of the basion. The basion is marked so you can appreciate how the radiographic image changes depending on the direction of the X-ray beam as it passes through the anatomy. Again, the challenge is to learn how to reliably identify the basion in lateral X-rays of the upper cervical spine. One very important clinical measurement is the distance between the basion and the tip of the dens. The dens is a finger-like projection attached to the second cervical vertebra. If the basion-dens interval, frequently referred to as the BDI, is too large or too small, there can be serious clinical consequences. In this video, the basion has been correctly identified, and as you can see, as the radiographic projection changes, there is minimal change in the BDI. If a radiographic feature other than the basion is incorrectly identified as the basion, particularly if the incorrectly identified feature is to the left or the right of the basion, then, as the radiographic projection changes, the BDI can change substantially, and this can lead to a misdiagnosis. It is very important to correctly identify the basion in the mid-sagittal plane. Now we will focus on the opisthion. The opisthion is here shown on the axial plane, confirming that it is in the mid-sagittal plane. In the frontal plane, you can see it is at the middle of the skull base. In the mid-sagittal plane, which is one of the most important views, you see the opisthion marks a specific point on the posterior-most edge of the foramen magnum. In this patient and patient positioning, the opisthion is very close to the posterior ring of the first cervical vertebra, but that will vary depending on the patient and the positioning of the head and the neck. To help learn how to find the basion and opisthion in lateral X-rays of the upper cervical spine, 9 clinical thin-slice CT exams of the upper cervical spine were used. The basion and opisthion were precisely located using axial, coronal, and sagittal plane slices like those shown in previous slides. Three-dimensional views were used to confirm landmark placement. Digitally reconstructed radiographs, referred to as DRRs, were created using Plastimatch with a wide range of radiographic projections. Copies of the DRRs were created with the landmarks shown. Animations were created from the DRRs with and without the landmarks shown. Careful study of these animations helps to learn how to place the basion and opisthion landmarks on X-rays. Here is an example of a DRR created from a CT exam of the cervical spine. Note that the landmarks are shown in only one image, as the images with and without the landmarks are alternately displayed. Multiple landmarks are shown. The basion and opisthion will always be the light purple colored landmarks closest to the C0 label. In lateral cervical X-rays, when looking for the basion, recall that you are looking for the specific mid-sagittal feature of the basion. Note that the inferior bone is thicker and denser than the opposite side, and thus may appear more prominently in the X-ray. Also keep in mind that there are many anatomic features to the left and right of the basion and opisthion that will appear in the X-ray, and the appearance will depend on exactly how the X-ray beam passes through the anatomy to the image plane. Here is a three-dimensional view of the region of the basion, with all the anatomy in front of the basion removed. This also helps to appreciate the complex anatomy to the left and right of the basion that will appear in the X-ray, and the appearance will change depending on the path of the X-ray through the anatomy. Here is a three-dimensional view of the region of the opisthion, with all the anatomy in front of the opisthion removed. This also helps to appreciate all of the anatomy to the left and right of the opisthion that will appear in the X-ray, and the appearance will change depending on the path of the X-ray through the anatomy. In finding the opisthion, you will see the radiographic features of the skull base to the left and right of the opisthion. Knowing that can be useful if the X-ray beam is not parallel to the skull base. With this knowledge base, and referring back to this video as often as needed, please review lots of examples of the two-view animations that show DRRs with and without basion and opisthion marked. Please review these until you feel comfortable with finding the basion and opisthion on lateral spine X-rays. It can help to work on training periodically over several days, as this allows the visual features to imprint on your brain. This type of learning curve or familiarity effect is a common aspect of skill learning.